Hi, Kevin Henry, the Group Editorial Director for Advanced Stars Dental Division, and I'm on a Google Hangout today with Angela Guanzini. And I feel like you and I are kind of soul partners here because I know you have that passion for dental assistants just like I do. And I'd love for you to tell our viewers a little bit about yourself and about your background, please.
Wonderful, awesome. Thanks, Kevin, for having me. Yeah, so I'm Angela Guanzini. I've been a dental assistant for about 15 years, and halfway through my clinical chairside experience, my doctor invested in digital technology. So we were using chairside CAD/CAM, CEREC at the time, and we also were beta testers for E4D technology. So simultaneously, we were able to use both systems and then decide which was best for our practice, which for our practice happened to be E4D. We also had the 3M chairside oral scanner, dental microscope, and really just started to see what digital technology was doing for me as a professional, as well as what it did for our practice, how it wowed our patients. And so there's just, so many times how you and I see dental assistants look at assisting kind of as a stepping stone to maybe moving on to hygiene, moving on to dental school, and I just really feel that dental assisting is a career that can take you in so many different, down so many different avenues, dependent on what you want to, where you want to walk. And CAD/CAM has definitely changed my life. I mean, it changed our practice, but it really changed my life. It made me a producer in my practice. And I think that that's something that assistants haven't been able to do. I mean, we can make bleaching trays and take our x-rays and whatnot, but ultimately saving a lab fee and being able to work with a patient solo while a doctor is working next door with another restorative assistant, so you're able to double up on production. That really is where Ninja Dentistry's come from. So Ninja is an acronym for No, I'm not just any assistant, right? So I'm a ninja, and it's about turning suction into production.
I love that. I mean, that's great. And, I've met dental assistants who have come up to me and they say, well, I'm just a dental assistant. And I always say, no, you're not. You are the dental assistant. And how do you, whenever you speak to other dental assistants, how do you let them know the important role that they play? How did you find that passion?
Well, when I started looking, when you show up to work and you're the first person there and you're the last one to leave, and then you start to go, wait a minute, so and I'm the least paid in the practice, you kind of get to that point where you do start to feel kind of ho-hum about what you do, but you know that you make such a huge impact on the practice. I mean, ultimately, at the end of the day, hygiene and dentists, I mean, we're all a great team, but the dental assistants really, truly are the backbone of the practice, from OSHA to ordering. And all of that is great and absolutely has to be done, but when I saw that CAD/CAM allowed me to generate revenue, so at the end of the day I could see a dollar sign in a production that I brought to the practice, that just gave me more value. It made me feel important. And I think that that's what I like to express to the dental assistants, that although we can save money when we're working with, let's say, our Shine or Patterson Bank, our reps on supplies, right? And say, oh, we're going to save $1 on cotton rolls here and $2 on gauze there, and we feel good about it. At the end of the day, we're not saving in our practice a whole lot of money. So it's finding what your true passion is, and how you can generate revenue into your practice to increase your value. So be it CAD/CAM, be it social media, or what are you doing? What are you doing ultimately is when I talk to them, to be a difference maker in your practice.
And for you, like you mentioned, that was really the E4D and the CAD/CAM experience. How much of that was you just diving in and learning versus like a team training approach?
Definitely intrinsic motivation. There's no doubt about that. I think that's part of being a ninja is, your ninjas are the assistants that want more, that are always willing to go above and beyond, not because they're asked to, but just because that's part of their character. And so for me, I saw it as a huge opportunity, and I appreciated the fact that my doctor invested in the technology and allowed me to take the reins and really take it to the ultimate limit. So when I think of it from a CAD/CAM perspective, I mean, my doctor, I call him the pilot and I'm his co-pilot. I couldn't be who I am without him, and I worked for a male, that's why I always say him. But ultimately, I think as an assistant, it comes down to your intrinsic motivation. If you're extrinsically motivated, well, then it's going to be more of a team approach. It's going to be, you know, the doctor and the assistant and all the team members holding hands together and plugging forward. But when you've got somebody that's intrinsically motivated, I mean, true ninja at heart, they're the ones that really want to make a difference for them, because that makes them feel better and more important.
You talk a little bit about the ninja dentistry. You know, you've mentioned it and you've talked about it just a little bit, but I really want people to understand what's at the core of the ninja dentistry, and how you really help assistants get that next level of confidence to really take their career to the next level.
Yeah, absolutely. So Ninja Dentistry, I started that, just launched it here this year, and when I mentioned the word ninja and I saw the light bulbs go on and the girls get excited and screaming and clapping, that's what really made me think that I could make a difference now on the actual profession of dental assisting versus just in my practice as a CAD/CAM dental assistant. And I didn't want, you know, when you're thinking about ninja, you don't want to say, well, if you don't do CAD/CAM, you're not a ninja, because that's not it at all. It's, you know, what do you do in your practice to take it to the next level? You know, how do you really empower yourself to increase your value? And so what I just started doing was speaking on it, and started the movement and created a Ninja web wall. And it's really a place for assistants to be able to blog, they send me text messages, they respond on Facebook, Twitter, Instagram, so that everybody can really just pump themselves up about what dental assistants do for a practice and where the industry is going. That's so awesome. From here, you know, kind of the sky's the limit. I mean, it's just in the very, very early stages.
Yeah, you know, I've seen so many times that the assistants, like you said, they're underpaid, they're overworked, they're underappreciated in so many ways, and yet they really are the backbone of the practice in so many ways. And talk a little bit about what's one piece of advice that you would give to every dental assistant out there about, again, trying to make this a career, not just a stepping stone.
The one piece of advice, let's see, I would say, you know, take a look in the mirror and just ask yourself, what are you doing in your practice to be a difference maker? And I encourage people and challenge them to approach their doctor and bring it to the table. Bring that energy to the table and say, hey, guess what? You know, I love what I do, but I'm ready for a challenge. And whether it be a team challenge, whether it be an individual challenge, you know, I'd like to know what I can do to help make our patient experience better and make our practice better as a whole. And when you have that confidence and you bring that, whether you have it or not, you know, you fake it till you make it, or you bring that to the table, you're really going to just express a different energy and different kind of aura about who you are and what you are in that practice. And so that's what I like to talk to dental assistants about, is don't just punch in and punch out, because at the end of the day you're going to get bored and you're going, and then it's moving on to the next place, and the grass is always greener. You make the grass green. You know, you stay where you're at and you grow that practice, and you don't ever have to leave when you do that kind of stuff.
That's awesome. And I just want to make sure that our viewers get your website so they can get more information about Ninja Dentistry.
Yes, please. So Ninja Dentistry, it's www.ninjadentistry.com, and it's Ninja, N-I-N-J-A, so no, I'm not just any assistant. You can follow me on Twitter at Ninja Dentistry, Instagram, Facebook, I blog, and it all goes straight to the Facebook. So look forward to, in August, there'll be a Ninja course, so that's the next parts that are coming up, is advancing and taking it to the next level. So introducing, you know, what do assistants know about occlusion, about bonding, about CAD/CAM. And so if there are things that you're interested in, understanding really technically the whys behind dentistry. So a lot of times I think as assistants we get, we're handing instruments, we're handing materials, but at the end of the day, why are we doing that? And if we knew why we're doing it, it just makes us a better assistant, because at the end of the day, our doctor is only as good as his assistant.
Love that. Absolutely. Angela, I really enjoyed the chat, and certainly I definitely want to do some more Google Hangouts with you that are targeted toward the assistants, and look forward to working with you.
Okay, sounds great, Kevin. Thank you so much.
All right, Angela, thanks so much.
You're welcome. Have a great day.
You too.